Welcome, parents. Thank you so much for taking the time of being here this evening with us. I'm excited to have all of you here. Thank you so much for your time. Today we have our Jennifer. She is with Anthem Blue Cross, and she's going to talk to us about mental health and some resources as well. And before we get started, I wanted to send a reminder that we are hosting a COVID-19 vaccination clinic here at the district, 264 Northwest Wood Street. And it's going to be there from May 27th to the 30th from 9 a.m. to 4 p.m. So anyone can come and get we're going to be offering the Pfizer vaccine. We accept walk-ins. So you just come up right through the district. You will see the signs and you're able to go into the room, and they're providing that for anybody over the age of 12. So that is a resource to you. Buenas tardes, padres y todos que están aquí. Muchas gracias por estar aquí, tomar su tiempo de venir. Vamos a empezar ahorita. Aquí tenemos la señora Jennifer. Ella trabaja con Anthem y va a hacer una presentación. Y antes de empezarmos, quería decirle que tenemos la vacuna de COVID, lo estamos ofreciendo en la escuela de mayo 27, empezando hoy, el sábado y el domingo, de 9 de la mañana hasta las 4 de la tarde. Si usted gusta venir, no ocupamos seguro, o usted puede venir caminando, y puede ser cualquier persona de 12 años para arriba. Pues ahorita vamos a empezar. Si ocupan traducción, la señora María Arroyo está en la llamada, y hay un globito abajo que se llama interpretación. Hacer clic, cuando le hacer clic te va a llevar el cuarto que va a hacer la interpretación. Y si tiene alguna pregunta cuando vamos haciendo la presentación, por favor ponen en el chat y así le podemos responder. Muchas gracias, y le voy a pasar a la señora Jennifer. If you have any questions along the presentation, please use the chat. We want to hear from you, and we will answer them as we go. And I'll pass it over to Jennifer. Thank you so much, Jennifer, for being here.
Of course. Thank you, everybody. Thank you so much for the invitation once more. Welcome to everybody. I hope that you are doing awesome. I know there's still a lot going on with COVID and with, our kids trying to get back into school, and us transitioning back into work, whatever that means. So thank you so much for being here. And I just want to confirm, can you all see my slides? Yes. Okay, perfect. Awesome. So I want to go ahead and get started. As you all know, or if you didn't know, May is Mental Health Awareness Month. And what that means is it's pretty much just a month to bring awareness to pretty much any of the conditions, right? Mental health is a whole other a realm, right? A whole other segment of our health that we don't really know much about, and that is very, very important. It's just as important as our physical health. And so the purpose of Mental Health Awareness Month is to just bring information on the different types of mental health conditions. And today we're actually going to talk about two that are the most common, or one of the more commons, which is anxiety and depression. So again, thank you so much for being here. If you have any questions, please put them in the chat. This is meant to be really interactive. So please go ahead and write in the chat. I know it's a little bit limited because we're on webinar mode, but please in the chat, put in your comments, your questions, your concerns, so that we can kind of really make this as interactive as possible. So I'm going to move on to the next slide. I just want to remind you all that I am actually a health educator. I am by no means a behavioral health professional. And so what I do is I kind of just bring information to people and put it in a way or in a language that is more understandable or that you can understand a little bit better. I do recommend that if you want somebody to talk to, or you think that you might have anxiety, depression, or any of the other mental health conditions that we have, that you please, please, please reach out to your doctor, to some of the resources I will share at the end. Again, just because it is a very sensitive topic, you want to make sure that you're getting the help that you need. I'm just here to kind of give you a little bit of information and just kind of find some ways on how to connect to resources and answer any concerns that you may have. Alrighty, so really quick, I do have to put out a quick disclaimer that today we will be talking briefly about suicide. And so I want to kind of bring that out pretty early on. So this may be difficult for some participants who have experience with suicide or are a survivor. So it's really important to know that I will bring that up. So this may be a little bit triggering. If you find it uncomfortable, you can definitely, of course, disconnect from the call. I'll bring it up briefly and I'll make sure to kind of remind you all again. But I do have to put that disclaimer out there. And this whole presentation really can be very challenging and difficult to listen to. But again, it's all part of destigmatizing and bringing, again, awareness that it is okay to reach out to people. It's okay to reach out to help, and it's okay for us to talk about these things, right? It's part of healing. It's part of learning things that are out there. I want to go ahead and put out the crisis numbers. Again, if you're having an emergency, please call 911. But if you're having suicidal thoughts, please call the 1-800-273-TALK line. They will, of course, talk to a skilled trained counselor at a crisis center in your area. Sometimes bringing up these topics can bring up a lot of feelings. So if you're feeling very heavy or anxious after this, please reach out to one of those. I'll give you a bunch of resources at the end. And again, we love your participation. We were here a couple of months ago. I was here with my colleague Irene. We talked about stress. And so we're kind of piggybacking off of that stress presentation. We love to hear you all talk. We love to hear all of your thoughts and your concerns and your questions. You all bring up super awesome stuff. So please, again, send us your questions, comments, and thoughts in the chat box. You can chat privately where it's just to the panelists. So if you want to ask something a little bit more private, you can select that option where you chat me kind of individually. Or just the panelists. And of course, your question will be safe with us. So we just want to make sure that you know that there is a confidential way to ask those questions, because again, this can be very, very challenging to talk about. So with that being said, now with all the disclaimers and all the intros out of the way, we're going to kind of, I'm going to kind of talk about what we're talking about today. So today we're going to talk about the relationship between stress, anxiety, and depression. Like we said last time, we spent quite a bit of time, hopefully you joined us that time, where we talked about stress. If not, no worries, we're going to review and kind of how that relationship goes. And then we're going to talk about the symptoms, right? What are the symptoms of some of these chronic mental health conditions? What are the risk factors or causes? So what makes us more likely to get diagnosed with something like anxiety or depression? We're going to talk briefly. Like I said, there are so many mental health conditions and disorders that are out there. We are still learning a lot to this day. So we're still learning quite a bit of, just so many mental health conditions that are emerging, or they're different. They have a different name than they had 10, 20 years ago. So it's really important to just know, I'm only going to talk in detail about anxiety and depression today, but just know throughout this presentation that that is not even surface level. There are other mental health conditions and diagnoses out there. And so if these, don't fit, it's fine. Again, there's so many people that can help you through any of those conditions. I also wanted to talk about warning signs, which that is why I brought up suicide, because you will learn that people who have these chronic mental health conditions are a little bit more likely to have suicidal thoughts or attempt suicide, especially when they're untreated. So that's why it's super important to know those warning signs, because you or a loved one may be experiencing them and may need to intervene at some point. We're also going to talk about treatment a little bit, what treatment looks like, and then what can we do for ourselves and for others. And again, this is kind of another like full circle kind of moment, because when we talked about stress, that was one of the things that we talked about, right? Is how to take care of ourselves, how to self-care, because a lot of us don't know how to, or have had to learn like what self-care is, and just the importance of really taking time for yourself and for what it is that you need. All right, so to review and to recap what we talked about a couple months ago, which is what is stress? What does stress mean? So stress, in short, is the body's reaction to a difficult, challenging, or scary situation. So it affects the mood, the mind, and your body. So for some of you, when you feel stressed, I know for me, I feel my heart just jumping like excessively. You can almost feel it in your throat. That is, again, a stress. So it's a reaction to some challenging or difficult or scary event. Now, there are, if you remember from our the last time we were together, there is good stress, right? There is good stress that motivates and provokes energy and concentration. There is good stress. And some examples of that are, I guess it just depends from person to person, because you'll find that like for some people, certain things stress them out, but for others, it motivates them. And the perfect example of this is sports. Some people, I did sports when I was younger, and I had a coach that yelled excessively. He yelled, he was like, run faster. I did like a more non-traditional sport, run faster. He was in my face. And I did not respond really well to that. I actually got really upset, and it would stress me out. However, some people, sometimes mostly male identifying folks, love that. It motivates them to run a lot faster, or to, hit harder, whatever it is that they're doing. It will do that. And so that's something that we want to kind of keep in mind, is that sometimes people, experience stress differently. The next one that I want to bring everyone's attention to, and if you remember this from last time, there is bad stress. Why is it bad? It's important to know that stress, everybody feels stress at some point in their day, in the week, in their life. Sometimes we experience it several times during the day, but it's very, very, very important to know that your body and you yourself should recover from that stress pretty quickly. So it's temporary. I want everybody to know that it's temporary. Another example is one time I was running with a friend, and we were at Woodward Park. So everybody knows Woodward Park, and we were pretty far out there. There was actually a snake that we kind of literally ran into. And we freaked out. We momentarily freaked out. We sprinted. One did the flight thing. I did the freeze thing. And what I want everybody to know is that that was a stressor, right? But about in 5 minutes or so, we laughed, we freaked out, we screamed for a bit, but in a few minutes we were fine, right? Our body, our heart rate came back to normal. We were okay. Now, say for example, every day we're running into that snake. We can't even go on about our lives without thinking, oh my gosh, is the snake out here? You don't even want to do activities anymore because you're concerned about that snake. You're constantly leaving your house, making sure that there's no snake. Your heart rate is high because you think you're going to experience this snake or bear or whatever, right? That is what chronic or bad stress feels like, and nobody should be feeling that constantly, right? Living in a loud or unsafe neighborhood is the perfect example of like a bad stress, or something that was a good stress and turned into a bad stress. And so what, if you all remember from that stress presentation, is that a person who is constantly stressed out, who is constantly having anxiety, can of course have chronic stress that can lead to health problems. That can lead, if you all remember, to high blood pressure, high blood sugar. You can experience a bunch of stomach issues, low immune system. But if you remember, one of them is that
Hacer débil tu
or have developed pretty much some sort of mental health condition, especially when it comes to like trauma or something like that. So, and we have this quote here, pretty much every head is a different world. Just by looking at people, we have no idea what is going on. And that's why mental health conditions, behavioral health conditions, and that sort of thing are a little bit harder to diagnose. Just because it's a brain, there's so much that we don't know about brains. At least with physical stuff, you can take a couple blood tests and things will be okay. We can kind of determine right away what's going on. With mental health, it's not that simple. So there's so much that a person may be going through that you absolutely have no clue what is going on. So I'm going to open my chat for the next portion, and this is kind of just reviewing from last time. And I want to ask you, who is affected by stress? I'm going to give you a couple options. Is it A, children, B, parents, C, workers, or D, everyone? And go ahead and put it in the chat. I'm trying to open it, but it's like not cooperating. Oops, and I gave everybody the answer. It's everyone. So it's really, really, really important to know that children feel stress all the time, especially teenagers. Hormones. The changes in life. So puberty, when we talk about puberty, when we talk about menopause, pregnancy, that is all hormones or changes of life, which can lead to stress. So this is why teenagers feel so like everything feels so big to them, even if it's like as simple as failing a test, or that their friends are mad at you or mad at them, right? They all feel this. So it's super important. Okay, I'm finally seeing the chat. Thank you, everybody. Oh, and Patty's here. Hey, Patty. So really quick, yeah, anyone can feel stress. So it's super, super important to just not discredit, especially children, right? Or young people in general, because a lot of the things, or a lot of the times what happens is that, kids or teens, young adults will say like, oh, I'm so stressed out. And adults tend to do this, is they're like, what are you stressed out about? You don't work, you don't pay bills, you don't have kids, you don't have this, right? It's not a competition. Everybody feels, again, stress differently. And it's really important to never shut them down. We'll talk about that later, about what you can do for other people, is not to discredit or to kind of dismiss their feelings, right? Because there are a lot of changes going on through people's bodies that we have no idea that are going on. All right, so now that we got that out of the way, we're going to kind of, again, recap what were some of those strategies that we talked to keep your stress under control. The first one is super important, and it's learning how to say no. I know that is so hard for so many of us, especially those that are parents, those of you that work in like social services or healthcare. We tend to be, all of us, very, very caring and people, and a lot of us express our love by acts of service. So we want to show people that we love them by cooking for them, or by spending time with them. And you tend to find yourself spreading a little too thin, but it's really important to learn how to say no, and setting boundaries is really what it is, because you need that time for yourself. Nobody should ever work a ridiculous amount of hours, right? Nobody should ever put themselves in stressful situations for super long amounts of time. So it's really important just to learn how to say no, and be like, you know what, I'm just so tired today. And I've done this all the time, where I had plans with friends on Friday evening. I don't know why I keep doing this to myself. I'm like, yeah, let's go bowling Friday evening now with things opening back up. And then Friday comes around, I'm like, actually, I'm super tired. Like, can we just cancel? And things like that are necessary, right? Or if you think you're gonna de-stress, sure, that's fine. But it's okay to cancel on plans. And again, if your friends or whoever is upset, it's kind of, it's a part, they're probably not the best friend to have, right? Because somebody who cares about you will respect that boundary. Disconnect. This is really important, and it kind of ties in with what I'm going to say with number 3 is neutralizing toxic people or pages. Social media, we've been spending a lot of time on social media, especially because of COVID. um, is I think I used to not spend so much time on like Instagram, and now I actually found, since COVID happened and things were closing, that I spend almost sometimes double or triple the amount of time that I used to spend before. For those of you that check your like screen time, I found that was happening quite a bit. I was like, oh my gosh, I've never been on Instagram so much. Same with TikTok. I discovered TikTok, and now I've been on TikTok a little too often. So what is really important, I want you all to know, is that there's so much information. Sometimes social media is like what they call the double-edged sword, right? It could be very positive, very informative, super awesome, great way to connect with people, but it can also be very toxic, very harmful. So it's important to know what upsets you and learn how to mute people, mute words, block people, and do that pretty often. So I have certain words, what I call muted, right, where I will never see this phrase ever. Any phrase, any tweet, anything with this particular phrase is not going to appear on my social media, and it's because I've kind of neutralized and disconnected from some of those negative things that I see on social media. Holding grudges, again, we'll talk a little bit more about therapy later. But a lot of us have probably experienced some sort of trauma. It could have been a traumatic accident. It could be something like that, but it's super important or have been in abusive relationships. So super important to get, again, therapy, or reach out to people, support groups, that sort of thing. Mindfulness, putting things in perspective, using your support system. Everybody has different support system. My support system is my dog. So it's really important to kind of have those things in mind and have really great, meaningful relationships that will be positive and not feel like a strain. So in the meantime, I think we shared last time, while you're in the comments, please write what you all do to cope with stress. How do you manage your stress? How do you take care of yourself? What is your favorite self-care strategy? My favorite self-care strategy is to take a nap. And once I wake up, I drink some coffee, hike, walks, perfect. Yeah, those are great. Even just opening your window to get sunlight is great. I had somebody once that presented, they would Google puppy pictures. And so they would just look up puppy pictures. Something that I started recently doing is I have 2 screens at work. And so what I do is I put the little waterfall sound on YouTube while I'm working. And so the water sounds are pretty soothing when you're doing work. So it's really, yeah, listening to music. So those are all really, really great ways to manage stress. Perfect. Now I'm going to move on to anxiety. Now I want to point out that there is anxiety and then there is anxiety disorder. And so anxiety is kind of like stress, but it's a little bit more than stress. And so if you look to the left, you'll see that it's your body's natural response to stress. It's a feeling of fear, of apprehension of what's to come. So most of the time it's fear, but it's kind of like fear of the unknown, right? So I think a lot of us felt anxiety pretty about a year ago, to almost to the T, or maybe a little bit more than a year ago, somewhere around March 2020. We started to get kind of a bit of anxiety because I know for me, I wasn't really freaking out. It wasn't until I went to the grocery store when I started to see like the toilet paper was gone, the bread was gone. The bread was gone at Whole Foods, which that's alarming because Whole Foods is like, it's always stocked. So it's really important just to know that it's a fear of what's to come, and because you don't have answers. Some people, and I'll go over symptoms in a second, but some people can feel pretty much the symptoms of stress, plus with an added, like, people go as far as sometimes like hyperventilating or breathing heavily. Now, I want to point out anxiety disorder, and this is when a person frequently has intense, excessive, and persistent worry. So they are constantly in that fear state where, or fear state of everyday situations. Some people have what they call like social anxiety, where every time they leave the house, it's going to be, a little bit intense. They have like kind of irrational fears, or just very intense fear is really what it is, especially when it's like they don't know what to expect, or something happens that they're not used to. And so it's really important to know. Now, I want to point out at the bottom is that anyone can feel anxiety sometimes, but anxiety disorder is a little bit more serious and may require treatment. So any of us can feel anxiety. I know I had this huge meeting come up, and I was super nervous about it, and I didn't even sleep. Like the day of, it was like 5 a.m, and I woke up and I started working out because I was anxious. And that's something that you feel every now and then, every once in a while. But when you start feeling this every day, like if I were a person who every day I was waking up at 5 a.m because I couldn't sleep, I was tense, I just had this panic about work or something like that, that could be a little bit more serious. So I kind of want to point out that distinction. And I have something in the chat. I'm trying to open it. My chat's like not cooperating. Okay, so now we're going to move into depression. What is depression? And so depression is a state of profound sadness and daily low spirits. So again, it's a state where a person is very, very sad, and a person is constantly feeling, again, really low spirits. Now, in the chat, I want to ask you all, there is a lot of myths around depression. And so I want to ask you all, true or false? Depression is the same as being sad. Again, this may be an easy question, but we're here to kind of address some of those myths and those misconceptions, and just to make sure that we're all kind of on the same page when it comes to things like anxiety, depression, and stress. Okay, so false, 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 false. No es diferente. Yes, perfect. Good, you're all super awesome. So yeah, it's false. All of us feel sad, right? Every now and then, but when a person has depression, right, it interferes with their life. It's expressed in so many different ways, and people physically sometimes feel pain, right, when they're depressed. And so I want to kind of point out that kind of like, it's kind of similar to anxiety, depression. There's people who are, mildly depressed, that they're okay without any treatment. But then there's people who are pretty intensely depressed, right? And will require some intervention, some even require medication, treatment, and a little bit more things like that. Okay, so what are the symptoms? And I want to point out, I'm not pointing the symptoms here so that you can use this as a check mark and be like, I'm unable to concentrate. I have this, I have this, I have this, therefore I have stress, or therefore I have anxiety. It is not that simple. It's super, super complicated. So I'm not putting them here to kind of like for you to self-diagnose. Please do not do that. I'm here to kind of just bring awareness that, and you'll start to see that some of the symptoms overlap. So sometimes a symptom of stress, we could easily confuse for anxiety, or anxiety could be really confused for stress, and vice versa. Same with depression and anxiety. They're kind of just here for awareness, not so much so that you can use this as a check mark. You never want to do that, because no single person is going to have, two people can have anxiety, and their triggers, what gives them anxiety, are going to be very different, and how they demonstrate anxiety is also going to be very different. So for stress, we've kind of talked about this. People are usually unable to concentrate, they're exhausted, but then they also have insomnia. So it's kind of, interesting where sometimes you can't sleep, but you're really tired, but you also can't sleep. Isolation is a big one. Sometimes people who are stressed will stay away from other people. People will sometimes feel headaches and nervousness when a person feels stress. Now I'm going to move over to anxiety. People who have anxiety will sometimes feel agitation, sweating, feeling in danger. So they kind of are always constant feeling like somebody's after them or that somebody is going to hurt them. Anxiety in the workplace looks something like they're nervous that like their boss isn't going to like them, or that their coworkers aren't going to like them. That's a little bit of anxiety right there. Hyperventilating is actually the big one, is that they start to breathe very, very heavy. And some of them even go into as far as having a panic attack. So if any of you have seen somebody have a panic attack, it's very scary, because they feel like they can't breathe, and it almost looks like an asthma attack a little bit. They really feel like they can't breathe. I've experienced other people having panic attacks, pretty common. And so it's really important to keep them calm. But that's a big, big indicator of anxiety that has gotten to the point where they're hyperventilating. And then tremors. Some people shake. Some people shake excessively because they're so nervous or they're so anxious. And then finally, we're going to move on to depression. So, of course, sadness, but again, it's extreme sadness. They have feelings that they're useless, guilt. They have no interest, especially when we talk about children. Children aren't the best, or teens aren't the best at communicating that they're sad. I think as we get older and we become more, adults, more open adults, we become a little bit more open and honest with ourselves and with other people. But children just have a really hard time communicating. And so what they will show though is that they're not interested anymore. So say you have a child who used to love playing soccer, right? Just an example, or they used to love band, right? Band was like their life. And from one day to another, almost instantly, they're not play anymore, or they're not interested in band all of a sudden, right? That could be a sign of depression. So it's really important that when, something like that happens, is to just kind of dig a little deeper, because it's pretty drastic movement where they have no interest in things that they used to love. No concentration. A lot of people who are depressed will express suicidal thoughts or behaviors, and I'll go over those in a second. People have insomnia, guilt, or emptiness. And so we'll talk a little bit more about depression. There's also postpartum depression, which I will kind of briefly touch base about. We'll talk a little bit about the risk factors right now. So a few things. So risk factors for anxiety. Trauma is a big one. So I am going to use car crashes as an example, because some of us kind of take for granted how, or we kind of minimize a little bit how traumatic sometimes car accidents are, right? We're like, oh, it's a little fender bender, but sometimes those really rattle us. For those of you that have experienced a little bit more serious accidents, right? I had one when I was like in high school. And for a while, I really didn't want to drive, right? And so that's a little bit of anxiety caused by trauma. A trauma doesn't have to be physical trauma. Like this person right here, it looks like they had like a leg injury. So if you have kids in sports, say they broke their arm once during football, and now after that, they get kind of flinchy, when that same arm gets approached, or they just don't even want to play anymore. That's caused physical trauma. I also want to bring up emotional trauma, right? People who have experienced some sort of emotional abuse, sexual abuse, any sort of abuse, that is a trauma. And that can, of course, cause anxiety in other people. And so it could be a result, again, of trauma. So trauma is physical trauma, but also emotional trauma. Family history. So if you have a family member who has had anxiety of sorts, or any mental health condition, honestly, they are a little bit more likely to experience anxiety just because of the environment. So some of those traits tend to be passed down. So I think some of us, like I've seen like tweets that talk about like, oh, the older I become, the more I become like my parents, right? We somehow take in those traits sometimes. So it's kind of important to know that sometimes our family has a lot to do with it. Personality. Certain personalities are a little bit more likely to develop anxiety. So again, it just has to do with, certain people are a little bit more nervous than others, or fearful, really. Illness, of course, as COVID has taught us, is COVID gave us a lot of anxiety, right? Now, a lot of us double think everything. I think a lot, one that just came up recently was how we really all just blew candles during birthdays, right? We blew candles during birthdays, and just all these, saliva particles are kind of on the cake now. Illness can cause a lot of anxiety. If you have been hurt before, if you did something, that hurt you, or if you experience some sort of illness, that is also cause for anxiety. And then finally, lastly, and again, this is where that relationship to stress kind of connects with anxiety, is stress buildup, right? A person should not be feeling that bad stress all the time. It's not normal for people to feel stressed like that. It can build up to something like anxiety, and that anxiety could even get worse. So it's really, really, again, important to take care of yourself always, and to reach out to help when you need it. Okay, so I'm going to skip to what are the causes of depression, and then I'm going to come back. So what are the causes of depression? And you'll start to see some overlap, right? And again, this is not, if you experienced one of these, it does not mean that you will absolutely indefinitely have anxiety or depression. It's just that you can potentially develop depression or anxiety. And second, it's to just realize that it's okay, right? Especially when we have things like a car accident, we think, oh, it was just a car accident, but it's really not. For some people, it really scars them, and it was a big event for them, and it really changed, them in some way or another. So it's really important that while some people are very resilient, right? Others, it could have affected them quite a bit. So what are the causes of depression? The first one is medication. Certain medication can have a side effect. I also want to point out life changes or a recent loss. So people who are recently divorced can experience depression. That's a pretty big life change, or a recent loss. So if you're grieving the loss of a loved one that you lost, again, especially like because of COVID, or not even because of COVID, with anything, right? Just natural causes. A loss is a loss, right? And so that can be a cause for depression. Another one is abuse and family violence. So people or families who are, experiencing some sort of violence, domestic violence, intimate partner violence, that can cause depression as well. Remember, that's a trauma. And so that can lead to anxiety and depression. Stressful events. So stressful events are a big one. Again, like I said, car accidents are one, but I want to also point out is even the whole, again, COVID, that was a very stressful event. Our lives were completely changed. Some of us more than others, right? Some of us, it was just as simple as like, you have to work from home now, but for others, it was a bigger event than that. So it's super important to know. People who also live in areas that are like war torn or experiencing a lot of violence, that sort of thing, or are fleeing like from a country because of persecution or something like that, that can also cause depression. And chronic illness, of course, can cause depression. And then traumatic events and family history. So I'm going to go back, and I know I'm talking a lot, so please feel free to, and I know this topic is a little bit heavy. I'm trying to make it as smooth as possible, but please, 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 it's a lot of information to take in. Again, I'm just touching on the surface of it. And it's pretty heavy stuff. So again, we'll talk a little bit more, but if you have any questions, I encourage you all to please put them in the chat. And again, reach out for help if you need it. We'll come out in a second. So like I said, we talked about anxiety and depression, but I want to give a moment to the other mental health conditions and disorders that are out there. Like I said, there are so many, and there's so many that we're still learning about to this day. So it's really, really important just to know. I know there's a lot of like stigma, especially for those that are, of minority communities or any really Hispanic, Latino, Southeast Asian, those sorts of things. Because we don't see people, we don't see when somebody is physically ill, we can kind of see that they're physically ill, right? When somebody is having a condition that's mental, right? Mental health, we don't see that. We don't see these things. And so it's really important to just know that you can never tell from just looking at a person if they're having some sort of mental health condition, or disorder. There's no way by looking at people just to know that they're experiencing something. So this is why it's super important. I know we hear this all the time, but you really don't know what's going on in people's minds, what conditions they may be having, what they may be battling. And so it's really, really important to kind of keep that in mind when you're interacting with people. I want to bring up the homeless population as well. A lot of people think that they're on drugs and that's why they're acting, erratically. But a lot of the times they're people who have misdiagnosed or or they just couldn't get the resources that they needed and have these mental health conditions. And, of course, when a person's untreated, they're going to have other issues as well. So it's really important to just kind of keep that in mind, that they're very hard to diagnose. You probably start to hear about people that, it seems like, oh, it's simple to just think, oh, they're just this, they're just that, right? But it's not that simple. It's very hard to diagnose these conditions, and people do often get misdiagnosed, meaning that they receive one diagnosis and really they have a few other years down the line. So I want to bring up a few things. Bipolar depression, and this changes. I think the name just changed officially to bipolar depression. There's two types, and so they're pretty different. And so it's basically when a person goes through phases of, depression, and then they're really happy, and then it just keeps going up and down like that. Eating disorders. Eating disorders are another one that we often kind of forget about a little bit. And so anorexia, bulimia, those are all what we consider, again, in the grand scheme of mental health conditions and disorders. This one might be, and again, sometimes people think that certain people look a certain way because they have anorexia or because they have bulimia. Again, it's not that simple. So again, it's never important. It's very important to never just assume that somebody has a condition like that. I want to bring up PTSD, or post-traumatic stress disorder. This is most commonly seen in vets. So people who have been to war, of course, will have PTSD from all the violence. But I also want to point out, we're starting to see this a lot in young people who are living in neighborhoods that are high in crime. So where there's a lot of gangs, and also countries, right, that they're fleeing from, that are in civil kind of wars with each other. People who are being detained at immigration facilities. You're starting to see a lot of young people with them, and it's because it's pretty much any stressful traumatic event that starts to affect, again, it's post-traumatic. So it's after they've kind of survived a trauma, they're starting to find their brain kind of processes eventually what happened. So PTSD, postpartum depression, I brought up, very, very common. That one has to do with the hormones, right? Your body is going through so many changes. After pregnancy, it's just hormones galore, right? They're up and down. And so that big drop in hormones or changes in hormones can affect the mental health of a person. And then there's schizophrenia, substance abuse. So there are so many. And so again, I really want, and some of them vary very differently, right? They're not all one and the same. The symptoms of each of them are vastly, vastly different from each other. So it's really important just to kind of keep that in mind. Again, that there's so much out there, and that it's, encouraging you all to just go see a mental health professional. And to just talk. Sometimes you don't even, you might think you just want to talk to people, right? I talk about this all the time, is that there's so much people out there that don't realize that they've gone through so much, right? And who would greatly benefit just from talking in a support group even. Okay, so I'm going to move on to the next slide. Now, this is where I'm bringing up the warning signs of suicide. And this is, again, not to scare people. I know this is very, very, very uncomfortable, but warning signs. And the reason why I talk about it is, again, people with untreated mental health conditions are most likely to attempt suicide. Why? Because they tend to feel kind of alone, right? There's so many reasons, but especially when they're untreated, right? Some of these are very intense mental health conditions. And so they need help. And when people aren't getting the help that they need, it can increase their suicidal thoughts. Now, people may not, there's always speaking warning signs, behavior, and mood warning signs. Now, like I mentioned, depending on the age of the person or the stage of life that they're in, a lot of us are not very good at speaking our feelings. So it's really important to pay attention to the behaviors and the mood of the people. Most likely a person who has attempted suicide will have spoken some of these key words saying, I want to kill myself. I'm hopeless. I have nothing to live for. I have nowhere to go, or I feel pain. They will say that in some way or another. However, like I said, some of them may not, because some people have a really hard time expressing those feelings. But for behaviors and mood, you'll start to see a person getting isolating themselves a lot from their family, from their friends, using a lot of alcohol and drugs, looking for ways. A lot of them will start to look for ways to commit suicide. So if you look at their internet search history, you might see that they were already looking for ways. Sudden stop of activities. I mentioned this earlier. If your child or somebody that you know used to love, going to the park, used to love swimming, and from one day kind of to the next, they stop just abruptly, that is a huge red flag. Just because, again, it means something big just happened, or they're attempting. Giving possessions away. A lot of them say, I think there was this case that I listened to not too long ago where one of the guys, guys in their PS4, their gaming consoles, they love those things. But this one person in particular gave it away to his best friend. And so everybody thought that was weird because it's a big possession that you don't just give away. And so that is like an example of that. Aggressiveness and, of course, tiredness. And then for mood, of course, lack of interest, humiliation. They feel like they're humiliating people. They're irritable, agitated, anger. So if you're experiencing any of these symptoms or know somebody that is, please call the number that you see, the 1-800-273-TALK. And then there's a text line also. So if you feel like you can't talk, because I know some of us live in places where the walls are really thin, text, there's also a text line. So text home to 741-741. All right.
Somebody
Now,
asked what the hotline's name is. I'm sorry.
This one is the National Suicide Prevention Hotline. So I know we have local ones, but that one is the national one. I think that's the one that was in the song not too long ago. I can't remember who sings at this point. But yeah, that's the National Suicide Hotline. And then the other one is, I believe, the National Crisis Text Line.
Okay, thank you. And another thing to point out too, sometimes they'll speak as if like in the past, like if they're no longer there. Sometimes you hear that when people are kind of, having these thoughts. So just something to keep in mind. It might not be direct, but it might be something as similar as they're speaking like they're no longer there.
Yes, perfect. And I think another one too is that they tend to say goodbyes in some way or another as well. Is that they'll hug you, like it's like they'll hug you and they haven't hugged you in a long time, like things like that, or they'll just say, hey, you were the best ever, best mom ever, best dad ever, that sort of thing. Thank you. Okay, now that we talked about the heavy stuff, there's light at the end of the tunnel. There is we're going to end on a more positive note, but there's treatment, right? There is a lot of treatment out there. And it's really important to know that, a lot of us feel anxiety or depression, or will feel it at some point in our lives. We're going to go through quite a bit of trauma, loss, and that sort of thing. So it is important to know that some people may experience it at some point or another. Now, there's two major ways to treat anxiety and depression. And then again, when we talk about the other mental health conditions, the treatment is going to look very different. But when it comes to anxiety or depression, we have two kinds, and it's psychotherapy and medicine. Now, psychotherapy sounds really scary. I know the term sounds like super intense, but it's not. It's exactly what you're seeing in the picture right there. It's talking. That's really what it is. It helps to control and eliminate those negative symptoms in order to have a good mindful day. Now, therapy itself can be, there's different types. There's so many different types of therapy. Some of us might feel a little bit weird sitting like with this picture, sitting with a stranger and just saying like, hey, I'm feeling sad, right? Some of us are not too, might find that a little bit weird, or find it even awkward at first. But just know that there are so many other different types. There's group therapy, especially for those who have experienced like domestic violence, right? There are a lot of support groups that talk about things like domestic violence, where you can talk to other women or other people who have experienced that sort of violence. There's also support groups for pretty much anything, right? Support groups of people who have suffered a loss, support groups for people who had a traumatic accident, right? There are so many ways. There's family therapy, right? Where people can have therapy with their whole family. Virtual mindfulness. Oh, there's virtual now. You don't have to leave your house now, right? And telehealth kind of exploded in this last year. Now it can be as simple as text. There's a texting one that I hear on YouTube all the time. Talkspace, there we go. I always forget about it. Where I believe you're just messaging a person. You don't even have to turn on the webcam. I know for some of us being on camera is still a little weird. But you can text people, and so it's really important to just know that there's so much for people out there. Medicine. Now, medication gets a little tricky, but in short, it basically helps control serotonin and noradrenaline, which are chemicals or hormones that are in our bodies, that kind of go up and down depending on anxiety, depression. And so they're kind of, up and down, not really constant. So that's kind of what gives us those symptoms of either anxiety or depression. So there is medicine to help control those. And it's really important to know that you have to take it as prescribed. It's not one of those things. I know we struggle with medication, but it's really, you want to take it every day as prescribed, and not when you're feeling these symptoms of like, oh, like I'm not feeling too well today, I'm going to take my antidepressant. You want to take your antidepressant or anti-anxiety meds daily, because eventually they help control. When you're not taking them daily, they kind of affect those hormones or those chemicals, and they continue to keep them out of whack. And I just want to point out that antidepressants do not cause dependence. I know that some people's concern with that is that they, to officially be dependent or to become dependent, it's another type of chemical, but just know that. Now, I want to point out that some people will benefit from psychotherapy and that's it. Some people will choose just to go the medication route. Some people can do a combination of both, where they do psychotherapy and medicine. So it's really important to know that, again, if you have a twin sister and you're both feeling anxiety or both feeling depression, that your treatment might look completely different. And it's based on your preference too. So again, if you prefer one over the other, that's fine. You'll talk with your provider, you'll talk with your therapist, like your mental health professional, to determine what works best for you. And we're coming kind of close to the end, but I want to point out, how do we diagnose anxiety and depression? We do not self-diagnose. Please do not go on WebMD. Please do not go on Google. I know it's so easy to do it, and we just have so much access to internet, and I've been guilty of it myself. Please don't do that. It requires, you want to go to a mental health professional to diagnose you with these things, right? Because again, they can provide us with the proper tools necessary to get through our conditions and our disorders. If you do, again, when you go to your PCP, you'll get a physical exam to make sure that you're well. People will get then a psychological evaluation performed by a mental health professional. And so they'll do a self-evaluate, you'll do a self-evaluation or a psychological questionnaire. You'll get questions regarding substances. And then after the evaluation, the provider will determine a diagnosis and then develop a care plan from there based on your diagnosis and of course your wishes, your needs. If you want to go the psychotherapy route, they will develop a plan like, okay, let's recommend you go to therapy X amount of times per month or something like that. So again, do not self-diagnose. It's just, again, it just puts us in like this whirlwind of like emotions. And it's just important to, again, we want to encourage you all to see your provider, see these mental health professionals. We want to encourage you all to reach out if you need help, and to make sure that you all know where you can get help. Now I want to point out, I kind of already touched on some of these. What do you do, or do you know someone who has depression or another mental health condition? What can you do for this? And the first few I kind of already went over is definitely offer that emotional support, understanding, empathy, and patience. I cannot stress that enough, is that it's not a linear, like it's like healing, right? Or grieving. One day you'll feel fine, the person will feel fine, the next they might take 10 steps back, right? It's not linear. So it's really important that they always know that they have you, and that they're supported. You definitely want to encourage them to keep taking their medication or in treatment. If your friend tells you, hey, I went to therapy for the first time today, be like, wow, that's so awesome. Like, that's super great. I'm proud of you, right? Things like that are great. I think one time, people sometimes will say, oh, I went to therapy, and they literally straight up ask why. And it's like, that's something that you should not do. Right? They have their reasons why they're seeking out treatment. And it's a big step. Going to therapy or getting treatment is a huge, huge step. So it's really important that you all encourage them and kind of, let them know that that was a great big step and that you're proud of them. And the third one is super important. I kind of said this already. Never laugh at them, minimize, or judge their feelings. They could be going to therapy because of, what you all think or what people think might be just a breakup, right? But it might not be that simple. It may be a breakup where the person was experiencing emotional abuse, or they were experiencing verbal abuse or physical abuse. So it's really important to never laugh or judge, people for making that decision to go to therapy or talk to a psychiatrist or psychologist. Invite them to go places, do other activities, and remind them that it takes a while, right? Some of them might start to get impatient, thinking like, oh, I've been going to therapy for years and I still can't get better, right? And just letting them know it's not it's a road, right? It's a very long road sometimes, so it's super important to make sure that they're all there. Okay, and so I think I saw somebody in the chat ask if you can overcome depression and anxiety without medication. Yeah, it depends. It depends on the severity of it. So some people, and that would be based on your circumstance and what the doctor diagnoses. A lot of people, can overcome it without medication. So I would again, and this is based on the recommendation of your provider. If your provider, you can let them know, hey, like I want to do this without medication, and just make sure that you take the recommendations of your provider. But yeah, it's definitely possible to overcome those without medication, especially anxiety and depression. What can I do for myself? We kind of already talked about this a few, times ago. Journal, see your progress. If you're seeing, a therapist, it's a huge step. Again, congratulations if you started therapy this month, if you reached out to somebody for help, or even if you said, I need help. It's super, super awesome. Do mild exercise. I think we talked about this during the stress presentation, is when you exercise, your body releases a hormone that makes you feel happy. And so things like that is super important, is exercising. Set short-term goals. People, want to feel better. They're like, oh, my next month, I want to feel really great. And that's not realistic, right? Sometimes it's years in the making that we've come. Like, a person does not go from one day to the next like depressed, right? It's usually a culmination of things. um be patient with yourself, right? It's going to take time to feel better. Spend time with your loved ones. Don't make big decisions while you are anxious or depressed, because that can you can make you're not in the right state of mind to kind of make these decisions. And then look for community resources to support your personal needs, which leads to my next point. We have, if you are an Anthem Blue Cross member, we have a Life Health Online application, which is where you can talk to somebody, a psychiatrist, psychologist, or a therapist virtually, how we're talking right now, on your phone. You download, I'll show you all the flyer in a second, without leaving your house. What a time to be alive in 2021, because you don't have to go anywhere anymore. They can come to you, or they can be in your home with you, thanks to technology and that sort of thing. We have the nurse line available. We have the National Institute of Health number. Your provider is a great way to start. So next time you go to your physical exam, you can let them know, see if they can make a referral to a mental health professional. And I want to bring up the county resources. The counties have kind of developed a warm line, which is non-emergency situations where you just want somebody to talk to, right? You just had a fight, or you had a fight with, you're having trouble with your partner, with your kids. The home that you're living in is like a little toxic. And you just want somebody to talk to. The warm line is excellent, right? Non-emergency, you just want somebody to talk to. That's the Tulare County number line. If you are experiencing emergencies or you need a crisis line, 1-800-320-1616 is the one for Tulare County. Then I added those two from the suicide hotline. Your kids' school. I want to point out your kids' school is a great resource, especially for children. So if you have teens, preteens, that sort of thing, who are having some sort of mental health problem or mental health condition, that sort of thing, or they need somebody to talk to, the school has people on staff who can talk through them with some of those issues, or refer them out if they need a little bit more help. So always check in with your school, because they have, again, people on staff to assist with those things while they're in school. And then 211. So for those of you that are not in or just want, I know I limited a few things, but 211 is a great resource if you want to just learn a little bit more about just anything. If you need more options for therapy and that sort of thing, that's a great way to connect with them. Now, we do have, I'm kind of going into just other resources here now. So I work for Anthem. And part of that, we do free virtual health education classes. You do not have to be an Anthem member to join these classes. As you all can see, we're pretty much going into June, and we're doing a men's health presentation. It's Men's Health Awareness Month. So we have a part 1 and a part 2. Part 2 will actually talk quite a bit about mental health and men. Which is pretty interesting, just because, of course, men tend to, some of the stats regarding men and mental health are pretty interesting, alarming. And so it's really important that we reach out to the men in our lives, and check on them as well. So the QR code should work. It'll take you to our Facebook page where you can register for some of those events. If you are an Anthem Blue Cross member and you want to get involved, we have community advisory committee meetings, which is where you can help us kind of just gather information about your experience with Anthem. So if you're looking for ways to kind of be involved, kind of advocacy sort of things, this is a great way. If you're interested, please let me know. And lastly, here is my information. The QR code, again, will take you to the Facebook page. That is my number up there, the 559 number. So if any of you want to call me regarding the presentation or want some additional resources, I forgot to mention if you're an Anthem Blue Cross member, or not even if you're an Anthem Blue Cross member, if you, with any of the insurances, call and check your insurance to see if they have some sort of resource as well. We have behavioral health case management. And so check with your, if you don't have Anthem Blue Cross, check with your other health plan and see if they have something available as well. I'm going to briefly get out of the PowerPoint while you all ask me questions. I'm going to show you Life Health Online and how to kind of download it. It's available on the Apple Store and on Google Play. And as you can see, we have a little person here that you can call, talk to about some of those mental health. If you feel like you are experiencing, or if you have been diagnosed already with a sort of mental health condition or disorder, please reach out to them because they have them kind of on demand. And so I wanted to just kind of point out to you, and I'll keep it on the screen while I go through see if there's any other questions. Okay, so I haven't seen, I think, all the questions I answered. But thank you all so much. I know that was a lot of information. I know it was kind of heavy at times, but again, you know, let's encourage each other to go to see mental health professionals, but also to take care of ourselves. You know, I always point out to people, I'm like, oh, you need a break, self-care, take a day off, you know. Let's support each other, especially like coworkers, right? I usually tell, you know, one of my coworkers like, hey, I can handle this, like, you know, and vice versa, we switch. So it's really important to support people, support ourselves, be graceful with ourselves. We tend to be so hard on ourselves and oh, I didn't finish this, I didn't finish that, I forgot to do this, I forgot to do that. I'm a bad parent, I'm bad this, right? Be graceful with yourselves. We're all doing the best that we can. And it's super important to just support each other and encourage everyone to reach out for help and congratulate and encourage those who have reached out for help.
Thank you, Jennifer. I have opened up the poll. Your feedback's much appreciated. With that feedback, we get to know what's working well, what's not working, what we need to do to improve it. And I just wanted to say thank you so much. I know it's a lot to be on Zoom, especially after a long day. It takes a lot of effort and your time is much appreciated. We try to get all the information out there to our, you know, our families, but also to educate you, and also so you can educate others. You know, sometimes you might come across a family, it's like, what do? I don't know how to support. Then you might at least have one resource, or at least be able to talk to them. And that's how we get more families, to reach more families, right? No, the slides will not be available on site, but if you need any specific resources, you can always reach out. But I will be posting this presentation on burtonschools.org under parent workshops, and that's where all of workshops are recorded, and I post them there on our website. So, and if you guys have any more questions, you can also find my number there. Any resources that you might be, you know, wanted to get connected, or just some questions, right? There's no right or wrong answer. We're not here to judge, we're here to support you. And this is a very tough time for everybody. So it's very important to really work together, you know, as a community, as a team. We're all in this together. And just, we wanted to be able to support one another. The more we know, the more we are able to support our families. So if there's any questions or any last minute questions, you want to drop them in the chat while we still have Jennifer here. And again, thank you so much for your time. Have a good night.
Bye, everybody. Thank you so much.
Bye.
Alrighty.